was little, I always wanted to be a nurse. And my mother and my grandmother taught us about the dream time, but they also taught us about forward dreaming. And my mother said, if you want to be a nurse, that's what you dream about. This concept of holistic care, sometimes they think it's a new one, but our people have been practicing it forever. And I learned that at my mother's side, when I was a little girl. And I guess that reinforced my desire to be a nurse. Even when I was young, it really impacted on me just how young, the people around me were dying, the network of people around me, like cousins and uncles and aunties. And I thought then, if I was a nurse, then perhaps I could help improve the health of my people. True caring. And as a nurse now, and I think we are slowly losing what true caring really is. Looking after the whole person, not just their body, but their spirit. And looking after their spirit is so important to their health and well-being. And I think that's what we, as Aboriginal and Torres Strait Islander nurses, can bring and teach non-Indigenous nurses about. There's been a lot of education, but we're still not getting it right as far as health goes and caring, and also I think it's important for people to read about our struggles and what we had to go through, because I think in a lot of cases people really don't understand. They have cross-cultural awareness training, but I really don't think they truly understand our struggles and what we've been through. And a book like this that CATSIN has published teaches people about the true struggles that we have had to endure to get where we are. I would really encourage my people to consider nursing, and because it's so important to Aboriginal health. Our people need Aboriginal and Torres Strait Islander nurses to be there for them, because we know the institutional racism that has existed in hospitals. I mean, my sister was 57 when she died, and she should never have died at that age, but she was too scared to go to the hospital because of the way she was treated. Now, we're still not getting it right, but if we've got Aboriginal and Torres Strait Islander people and faces that our people can connect with, then we break down those barriers. And not only that, I think to encourage people into nursing, it's that, caring. I mean, I specialise in aged care, and, elders so important, and for me to be able to care for them and make their last days just so much easier gives me great satisfaction. And that goes with caring for people, my people in hospitals, to be there, just to care for them and to guide them and to be there for support is great satisfaction.